Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we are going to be discussing Kaltostat. But first, if you could hit the like and subscribe, it would be greatly appreciated as it does help my channel grow. Kaltostat is a sterile calcium sodium alginate, so it's a wound filler or contact layer dressing which absorbs exudates. So you're going to use this for moderate to high exudating wounds. It is so absorbent, so if you don't have enough exudate, it's just going to stick to that wound, and then when you're pulling it off, it's going to cause a lot of damage. So make sure if you're using this that you have a lot of drainage, moderate to high exudating wounds. Okay, so it does cause when the exudate gets into the alginate, it causes a firm, moist gel pad, which is highly absorbent. Okay, so it is effective at controlling minor bleeds, and that goes across the board for any alginate. We can use them to control a bleed, a minor bleed. And this does require a cover dressing, okay? So you would put your alginate down, and then you need your secondary cover dressing, and you're just going to use an appropriate cover dressing for the amount of exudate you have. Because remember, we want that just perfectly moist wound. We don't want it dry, we don't want it saturated, we want it just nicely moist wound. So indications for use, we're going to use this on wounds with moderate to high amounts of exudate. So we want to make sure that they're not dry or just a little bit of drainage coming out of them. It's got to be that moderate to high amounts because the alginate, and this goes across the board for alginates, they are very absorbent. And if we don't have enough exudate, they're just going to stick to that wound, going to be very difficult to get off, and then a lot of fibers will stick to that wound. So we have to make sure that we are using this appropriately. So you can also use this on minor bleeds for superficial wounds. Now, precautions, we are not going to use this to control a heavy bleed. It's not going to stop a heavy bleed, but more a minor bleed, it will help stop it. And we're not going to use this on dry wounds. Contraindications is we're not going to use this if a patient is sensitive to alginate or the ingredients inside the alginate. And we're not going to use this on third-degree burns or surgical implants. So if you see a surgical implant in the wound base or tendon, ligament, bones, not your choice to be using this. So we will not use this with anything in that wound base. So to use this, first we're going to clean the wound like we always do, either normal saline or sterile water, and just clean out the wound, clean out the peri-wound to clean that off. Make sure you have a clean wound, free from debris, loose debris, and then dry off the peri-wound tissue. Next, we're going to choose an appropriate size dressing. So either the ribbon or the patch to fill whatever space that you have. So this can be double layered or as many layers as you need to fill a dead space. For packing, make sure that we only want to use one ribbon, and that there is a piece of ribbon sticking out past the wound so it can be easily removed and easily found for whoever is changing the dressing next. And then we're just going to apply with an appropriate cover dressing. So we always want to think about moisture balance because that is the most important part of healing a wound. We want a moist wound. So whatever cover dressing, we want to make sure we're not keeping it too dry, not keeping it too wet. So use the appropriate cover dressing. So to remove the dressing would turn into a gel pad when it is saturated with exudate. So the drainage, it's going to turn into a gel-like pad. you're going to gently remove this pad with forceps or with irrigation. So normally you're just pulling it out. If it is stuck a little bit though, make sure you're irrigating it so we do not cause tissue damage. We're trying to heal the wound, not damage it by taking off the dressing. Frequency depends on the amount of exudate you have coming from that wound. The dressing technically can stay in place for up to 7 days, but once again, we need to be monitoring it, making sure that our moisture balance is obtained properly. The expected outcome is that we don't have any skin maceration around the wound, and if it's for bleeding, that minor bleeds are managed. I did include here, I'll just get my little pointer, the different sheet sizes. There is also rope, it only comes in one size, but here are the different sheet sizes. So that's all I have for this video. I hope you found it very helpful for your practice, and I will catch you in my next video. See you guys.